Welcome. We're about to start our first live webinar. Before we start, we're just going to wait for 1 minute to allow for more participants to refresh their screen and be able to join us today. And while we're waiting, if you're already watching us, I would like to remind you to please scroll down and click yes to the survey that you're watching live so you can receive the extra points. Okay, welcome everyone to our first live session of the Social Entrepreneurship for Innovation in Health course. This course is part of the Making More Health initiative, a partnership between Ashoka and Boehringer Ingelheim. Making More Health explores innovative pathways to improve access to healthcare for people, animals, and communities around the world. And in this course, participants connect with a global community of health professionals from across the public, private, and nonprofit sectors and convene to learn entrepreneurial strategies for innovation and business impact in the health and wellness space. This is the 22nd version of the course, and we are very excited that we have had over 3,500 participants since 2015. My name is Nathalie Zuniga, and I'm one of your course facilitators. And today I have the pleasure to have here with me and introduce our guest expert, Cynthia McKinney Drayton. Cynthia is Director of Corporate and Foundation Relationships at Project ECHO, founded to bring quality and cost-effective healthcare by building local clinician capacity to rural and underserved communities throughout the world. Cynthia, thank you so much for joining us today.
Thank you for having me. It's a pleasure to be here.
So nice to have you always. Can we start just by you sharing with us a little bit about your professional journey as an entrepreneur and as an entrepreneur?
Sure. Many years ago, I just graduated from college and went to New York City. I landed what I thought was my dream job at the time with National Geographic magazine. I had grown up in, ironically, Arlington, Virginia, which is where Ashoka is based. Uh,
Mm.
where, and of course, grown up with National Geographic my whole life, and the headquarters were in DC. But in New York City, there's an opening in their New York City office. And so it was a wonderful experience and a wonderful job, but I made no money. And so that was really the initial impetus behind just wanting to start my own business. I thought I needed something that was going to be disruptive, because if I just went along that path living in New York City, the whole reason I went there to experience the museums, go to the theater, all the things that are wonderful about living in a big city, I couldn't do any of them. So I came up with an idea and ended up starting a business where I ended up working with women, primarily women, manufacturing in Southeast Asia, selling to the product to, which was children's and ladies' clothing, nothing to do with my academic background or my work at National Geographic, but uh, just tossing around ideas with friends one weekend, came up with this idea and ended up selling to every major department store, boutique, and mail order catalog throughout the United States.
Wow.
Private label with Marks and Spencer's. I was licensed through Disney, World Wildlife Fund, others, and felt like I had a little bit of my 15 minutes of fame. The product was on Good Morning America, The Today Show. Those are probably not names that I don't even know if people know today, but this is
You were on
pre-internet.
TV. Yeah. Yeah.
So I built that into a multi-million dollar business over the course of 17 years. But during that time, life changed pretty dramatically for me. And I had gotten married. I'd had two kids, really two boys, I should say, really wanted a girl, tried one more time and got twin girls. And so I found myself really needed to transition. It was one of the hardest transitions I've ever made because my business was my baby in so many ways. But during that time in the business, and before I took that time out, and before I ended up joining Ashoka, working with, and what led me to Ashoka was working with women in the Philippines. And one year I wanted to go out and thank them. The quality of their work was so amazing, and I felt that they were so, in many ways, responsible for much of my success. And so there's one particular village where I employed the entire village, all the women in the village. This is a village when I ended up visiting that had no running water, no electricity, women sitting in on their porches in huts on stilts, doing the hand embroidery. And it was pretty amazing. They had never seen anyone, well, they weren't used to people like me. I was 23 years old when I started the business, so I was probably about 26 when I went to visit. And I come back, I'm blown away by their craftsmanship, and we stay in touch. Of course, manufacturing meant I needed to be in Southeast Asia quite often, and so I was back out there the next year. And through the factory I was working with, I received a message that they really wanted me to come out again. And I had a tight schedule. I wasn't sure I could make it, but they were really insistent. And so I go back out, and it's about 3 hours outside of Manila. And I go back out to this village, and they had arranged for me to arrive around 11 a.m. And I get there and I start to put two and two together. I can see all the children in the village are in this uh, open, kind of thatched roof, open-aired community center with desks looking at a big screen TV and lessons that were being broadcast from the Philippines. You have to understand the Philippines has thousands of islands, and so they're early adopters of technology. And I looked at these women, and they were all, full of smiles, and they all run up to me and hug me, and I start to cry actually because it was so moving to see. And they said, we wanted to show you that we all pooled 20% of the income from the opportunity that you've given us. And we wanted to do something for the children of this village. And we've never had the ability, none of them have ever had any schooling. And so we brought in an well, what they did is they brought an electrical line, they brought a big screen TV, and the government just always had, they had a broadcast to local
Yeah.
villages. So it was really what I think at Ashoka we call that aha moment. And
Mm.
it really kind of changed the course of my life. And so fast forward, kind of looking, I took a little bit of time out to raise a family. And then looking at what I wanted to do in, 2.0, Cynthia, and this organization called Ashoka kept coming up as just the place I thought I wanted to be at. And but I lived in Philadelphia and they're in DC. I didn't think that was going to be possible, but in any case, I ended up meeting a person. His name's Charlie Brown, actually, who ended up, really seeing the what I could offer. And I have this other side of my background. I grew up as a competitive figure skater, and I raised my kids in sports because I see the value of
Mm.
sports. And so they had the need for someone who, my background in, apparel and products like that. Nike was the first corporate partnership to partner with a nonprofit, and they needed someone to lead that partnership. So I came on board Ashoka to lead that partnership. It's something that hadn't really been done before. Definitely took entrepreneurial skill, I will tell you that. um, and or the transferring of that entrepreneurial skill to the entrepreneurial skill, and went on to build the practice of our corporate partnerships as well as foundations and working across many, many sectors. And through through that work, I met our Ashoka fellow, Dr. Sanjeev Arora. He's the founder of Project Echo, and I'll talk about that a little later.
Yeah. Thank you so much, Cynthia, for telling us about your story about how you started as working at National Geographic, then became an entrepreneur yourself, and then went and moved into a social entrepreneur. So that leads me to the next question, and it is to lay the foundation of this first module. It's what's the difference between a social entrepreneur and a social entrepreneur?
Well, I've sort of alluded to it, but a social entrepreneur is someone who applies business kind of acumen to a social problem, but does it, uh, you know, outside of an organization, in fact, creates their own organization to solve a complex problem, an innovative solution to a complex problem or a need in society. And a social entrepreneur is doing much of the same thing, but within an organization. They see a challenge, something that might be innovative, requires disruption in a good way, and then applies that same skill set, but to a challenge or that perhaps a corporation is best suited, for example, to address.
Right. Yeah, perfect. And regarding that, I already have a question from the audience from Emmanuel Fajasim from South Africa that is asking, what would you say are the most significant skill sets an entrepreneur must have to make their innovation successful?
Well, first, I would say creativity and innovation itself. That's, coming up with the thinking outside that box and coming up with the idea to start. I think being a risk taker, I think any entrepreneur has to be willing to take a risk and therefore perhaps fail. But that does not mean they don't continue. That leads to being resilient. If you haven't, it's not really you're failing, you're pivoting,
Right.
and really taking that mindset of, okay, this didn't work. What do I need to do to make it work? To, finding, not taking no for an answer, also, from superiors, from peers, and just from the situation at hand. And I would say it's really important to have vision. You envision the solution, the world that you want to see, so that because if you don't have that vision, you can't achieve it. And then self-motivation, and then last but not least is empathy, because no social change happens without empathy.
Absolutely. Absolutely. And I have another question here as actually, let's wait for this one until after. I'm going to ask one myself, and then we're going to wait for this one right afterwards for the audience. So to keep laying the foundations of Module 1, I also would love to hear from you. What is the business case, or what is the opportunity for companies and institutions to actually promote entrepreneurship practices within a large institution and organization?
Yeah, I think that it's so important to encourage that innovative mindset, that entrepreneurial skill set and mindset within organizations and corporations, because that is what fuels the future and the success of any organization, corporation, nonprofit, doesn't matter what it is. Without that, without allowing that to flourish, you die. And so I think that corporations have started to realize that, not even started. We're going back 15, 20 years at this point. The understanding that it's just key to any to flourishing as an organization. And that means the retention of your talent too. It's so important to, you have, especially, for example, in the pharma industry, where it takes years and years and years to bring a blockbuster drug, say, it could be your entire career is spent working on a particular drug. And so you want to, that talent, you want to retain that. And to do that, you want to encourage that innovation, because that's why they're there. They want that opportunity, and you want to encourage that. So there are many, many reasons, but I think just it's really organization's future. It is, their sustainability.
Right. Wonderful. And I have a question here from Joyce Bahati. What tips might you have for entrepreneurs within countries that have relatively small economies?
We're seeing, particularly at this moment, that so much innovation is coming from it. Great solutions are coming out of, uh, you know, the moment that we're living in, where there's a lot less public funding, and it's requiring, when I think of when I started my business, I started it out of like a need, like
Yeah.
and so out of the need for solutions, there, I would say that you can start small. You want to start to engage others, because anything you can't do it alone. That's just,
Yes.
so teamwork, finding champions that think the way you do, or bring them along to think the way you do. And so even if you start small, I think that there's so much that can be done. In fact, I think that's the only way to really get it done. And local solutions by local leaders, you know, more power to you, because that's really where it's at today.
Absolutely. And Ahmad Hassan from Egypt and also Manasvi Sharma are both are asking similar questions. What strategies would you recommend for overcoming internal resistance, especially when proposing ideas that require cultural or structural shift within a company?
So I would say that the most important thing is to start to get, again, back to teamwork. Find your champions within, or cultivate your champions within an organization. Again, you cannot do it alone. And so, you start with one, and now you've got two, and each of you now are going out, and you'll find that it spreads exponentially. Two becomes four, and then eight. And before long, you've got a lot of people thinking the way that you do. And so I think that it starts when I first came on board at Project Echo. Uh, I was, I thought that, oh yeah, everyone wants to work with pharma. Well, we're a health nonprofit. Of course, we want to bring in money from pharma. Well, that wasn't the case. I had to do more internal work. It was easier to bring in pharma funding than it was to get my peers to want
Right.
to work with pharma. And so that's all changed, but I'd like to think that I lay that foundation and the why of it. And today, and and created opportunities. So I think the other thing is, if you can pilot something in a small way and get proof of concept, that
Yes.
would be the other thing that's so important.
So you can prove that it works.
So you prove that it works, and that naturally brings more people, more champions on board.
Yes. And then good communication skills so that you can also share the story and get
Absolutely.
that's what.
Storytelling couldn't be more important.
Yes, absolutely. Wonderful. I would love to hear a little bit more about Project Echo. And if you can share maybe a concrete example of like social entrepreneurship that you have witnessed, that you have been part of, so that our audience can get familiar first with Project Echo, the work that you're doing, and the example.
Sure. Uh,
Wonderful.
so Project Echo started in 2003 by our founder, Dr. Sanjeev Arora. He's an Ashoka Fellow. And in 2003, he was the only gastroenterologist that was treating hepatitis C, infectious disease, that we even then knew how to treat and cure. There were 28,000 cases in the state, but as the only specialist treating it, he could treat about 150 to 200 cases a year. Hepatitis C is a disease that, if left untreated, turns to liver cancer and death. And so he found himself just really having to, grapple with the number of people that were dying of a disease we do know how to treat and cure. one day a woman walks into his office with a 14-year-old boy and a 9-year-old girl, and she says, "I'm here for treatment." And he says, uh, "Oh, what brought you in?" And she says, "Well, I have hepatitis C. I've had it for 6 years." And he said, "Well, why did you wait so long to come in?" And she said, "Well, I called your office. Your nurse told me that there's an 8-month wait to see you. And I'd have to drive the regimen. The treatment in those days was chemo-like regimen, and I'd have to come every month for about 9 months. And I live 3 hours away each direction. My car is unreliable. It's very difficult for me to take off work, and I don't have childcare." And so he said, "Well, what made you come in today then?" And she said, "Well, I'm having pain in my upper abdomen." And he did an ultrasound, and sure enough, it had turned to liver cancer, and she died 6 months later. And he asked himself, why did this woman have to die of a disease that we know how to treat and cure? So he came up with the echo model, and I'm going to share my screen. Sharing is not turned on. Okay, I've just
That's,
sent a request to see if I can.
I think you need to be, sorry, let's see.
I can talk through it too. It's more effective with slides, but if maybe,
Let's see if we can get permission.
well, while we're waiting, the uh, the echo model that Dr. Aurora came up with is a fairly simple model. It uses technology to leverage scarce resources. So we have a global Zoom license that is given to us for free by the founder of Zoom, Eric Yuan, because of the mission that we have. And that's embedded into what we call iEcho, a platform that really has made joining Echo and the management and the evaluation and monitoring of outcomes much more seamless for our over 1,500 partners throughout the world. Through these, it's one-to-many video conferencing. So the idea is to bring experts to rural and underserved, mostly primary care, so community health workers, nurses, primary care doctors, and other clinicians throughout the world, and bringing those local experts. Say, for example, let's say you are in Kenya. The experts might be from Kenyatta Hospital, and then the clinicians joining could be from rural communities throughout Kenya. So they're sharing those best practices to reduce disparities. And then the clinicians that are joining, they actually bring cases that they're seeing in their communities. So it's based on case-based learning. Dr. Aurora, when he first started, he went around all of New Mexico asking primary care doctors if he said, "I'll give you my protocol because I want you to be able to treat hepatitis C in your own community so that we can save lives." And at first they said they would, but then they said, "Oh no, that is way too much liability. We could never do that." And so they said, "You're a specialist, we are not." And so he asked himself, again, he got, this is an example of in his case, a social entrepreneur, because it became his own organization, but not totally, because it's associated with the university. So in some ways, he's still an entrepreneur, using many of the resources from a large university here in New Mexico. But he said, he asked himself, how did I become a specialist? He said, well, I would, during my fellowship, how we train doctors in this country, I would see a patient, report back, share back with, and discuss with my peers and my professors. And I did this day in, day out for 2 years. And they started calling me a gastroenterologist. He said,
Right.
aha, that's exactly what I'm going to do here. I'm going to use case-based learning to help master complexity. And then that fourth one is to
Yes.
monitor outcomes. And so,
And that you are a co-host, so whenever you would want to, if you want to share some slides,
okay, great.
should be able to do it.
Okay, so I just So fast forward to 2011, the amount of time it actually took to raise the funding to do a patient level outcome study, he published in the New England Journal of Medicine a patient level outcome study, the results of which basically said that primary care doctors that participated in Project Echo had the same cure rate for hepatitis C as
Wow.
specialists at the university, at a center of
Amazing.
excellence. And that opened the floodgates. He knew he had a model then for any disease area anywhere in the world. And so basically, the model itself connects experts with frontline health workers in underserved communities. And then we see a ripple effect happen when participants share their expertise with peers, and it goes on to improve the lives of hundreds in their communities. And what really is the difference between traditional training and actually, I should put this in. I think that's better. Traditional training and Project Echo is because I've heard Bill Gates, for example, says, oh, traditional training doesn't work. And we actually agree with him. Traditional training doesn't work. Traditional training is you go in and you sit in a room in person for 3 days and you listen to someone talk at you and you come out and maybe you've gained 20% more knowledge than you had prior. But then you get out into the field and you're like, oh, you see the first complex case and you're like, I didn't learn that in the training. And you kind of freeze up and you don't actually learn to implement the best practices. So the real difference with Echo is it's high frequency, low dose,
Mm.
using the virtual platform, but mentoring, it's telementoring, holding the clinician's hand. While they treat their own patients, they get the feedback from experts and their peers in that all teach, all learn, so that they build the confidence to implement the knowledge, to implement those best practices, and thereby bridging that gap between knowledge and implementation. And so today we have over 700 peer-reviewed publications saying that
Wow.
it works, and addressing over 70 disease areas. Uh, the yellow dots there are super hubs. We realized the model had to really it's morphed so that we had to get out of our own way. The demand for Echo is so great that we needed to start training other people to train people to do Echo. And so those yellow dots are those what we call super hubs. And for example, in Texas, one is MD Anderson, and they train people not just in the United States, but around the world to do Echo for cancer. Our global hubs, this is the footprint for that. And then an example of entrepreneurship, any of our initiatives, I would say, but Echo in India, we partner with the federal government, so across the entire country, we have an MOU with the federal government, but then we are partner because health gets rolled out at the state level. So we have partnerships with all the states as well. And then beyond that, they have 5 national programs. We are the capacity building arm for the government, as we are in many ministries of health throughout the world. And in TB, we're part of one of their 5 national programs is their national TB elimination program. And so we know that it's preventable and treatable, but India so this is the problem. We're always looking to solve a problem. And the problem is that India has the highest burden of TB and accounts for a quarter of the deaths worldwide. Um, we know that there's a paucity of healthcare providers, lack of lab technicians, a hesitation to prescribe new drugs, so that lack of confidence, lack of knowledge, all things that Echo can help with. And so, you know, it just by simply capacitating healthcare professionals, we can change the scenario for TB and really help the government. We really, work with ministries of health. That's really critical in our work and our long-term sustainability, because we want them to adopt it at the end. We want to show them that they can achieve their mission. They're never our priorities, they're our partners' priorities. We want them to achieve their mission with speed, scale, lower cost, and greater impact. And so because we already had the network across the country, we were able to strengthen the healthcare workforce for TB and amplify the TB treatment. And then one of the big issues is that women and children don't often get treated. And so with ECHO, that becomes, we look at where the gaps are, and we look at the solutions and how we get that done. And this requires many entrepreneurs, you could say, coming together to work collaboratively to tackle a challenge. And so this is working with the state government, the national government. They're part of the government that works on women and children, and kind of bringing everyone together, subject matter experts, people at ECHO. Everyone's got to be, all hands on deck to tackle a very complex challenge like this. And today we have trained, just in 3 years, over 60% of the total workforce in India.
Amazing.
And this is I could show this, or I can just maybe send this to you.
I think we have time. We can see. It's 3 minutes, right?
Yes, it's 3 minutes. So this is actually how we are envisioning using using AI. And it actually takes you through the journey of using iEcho, which is our platform, how we're thinking about leveraging generative AI. We're working on this. This is still aspirational. We're in the process of building this with the founder of Infosys, who actually helped fund and build our platform.
Introducing Echo 2.0, an AI-enabled, asynchronous enhancement of the Echo model to transform learning outcomes at scale. Meet Dr. Shobha, a TB doctor based out of Andhra Pradesh, India. A patient with a complex case of TB visits her clinic, and she is unsure of how to treat him. A colleague refers her to Project Echo. She downloads the iEcho app and signs up to join the movement. iEcho analyzes her information and prompts her to take a short quiz on TB to assess her knowledge level. Based on her professional background and knowledge level, iEcho suggests her to join the Introduction to TB Management Echo program conducted by the National Institute of TB. Shobha takes part in weekly interactive Echo sessions with national experts and learns about best practices in TB management. She presents the complex case of her patient to the panel and gets expert guidance. iEcho, powered with Apurva AI technology, analyzes the case and finds a similar case from South Africa. Shobha uses iEcho to connect with the doctor from South Africa who presented that case and gets additional perspectives on her patient. She applies her learnings from the Echo sessions and treats her patient successfully. In addition to the live learning sessions, Shobha uses the iEcho discussions forum to interact with her community to continue the learning asynchronously. She accesses asynchronous learning videos and reading materials at her convenience. She is prompted by iEcho to join the global TB Echo community of over 50,000 TB professionals from around the world. She interacts with the global community, and her knowledge further improves with access to global best practices. Through the global community, Shobha comes to know of an advanced course on TB management to further enhance her knowledge. She completes this advanced course and receives a digital certificate from iEcho and a badge to certify her as an expert in TB management. As a verified expert, she now creates her own Echo program in her native Telugu language to build capacity in the villages of Andhra Pradesh.
Amazing.
Time. Apurva AI analyzes trends in patient cases being presented on the Echo network and sees an uptick in a special type of drug-resistant TB cases being reported in a particular district. This information is highlighted to public health authorities to take action. This revolutionary innovation of the ECHO model will offer great benefits to learners, experts, and the community at large. Imagine a trusted human network of 20 million first-mile professionals like Dr. Shoba, empowered with artificial intelligence to improve community outcomes and build a society resilient to future pandemics.
Okay.
Very impressive.
As I said, we're working on that, and we probably got it about halfway implemented, and probably then we'll be working on something else because I'm sure you know, technology never sits, it can't, just like business can't sit. It's why you need innovation everywhere. And I would say that everything that ECHO does is the result of an army of entrepreneurs.
Yes. Yes. And everything is changing so fast, especially with all these new technologies. And that also, what you were saying is bring us into like how important it is to work together and in partnership, as Project Echo does all the time. And I have a question from the audience regarding that. What are the most significant barriers for multi-sectoral partnerships that you have seen, Gal Filk?
I'm sorry, what are the most what?
Important barriers, significant barriers in multi-sectoral partnerships, in partnerships with like governments, companies, NGOs.
So my title actually is Director of Strategic Partnerships.
Yeah.
It was the other, but that is the area that I'm most passionate about, because that's where that's how you're actually going to embed an idea like ECHO and get it adopted by, our sustainability model is to do exactly that, to give away the model and prove to engage the public sector, the ministries of health, prove to them that they can achieve their mission with speed, scale, lower cost, and greater impact. The challenges are simply that the more stakeholders you have, the more complex bringing everyone together and getting them on the same page is. One of the things that we do is we don't have an agenda. There is so much need for what ECHO does in the world if we want to work on the priorities of the ministry, because if it's their priorities and we're helping them solve their problems, then we know that it's going to be adopted, and that gives us that exit strategy. We're doing that right now in Indonesia, where we signed a general MOU. It started with just cancer. Today, they just got a $4 billion loan from the World Bank to buy equipment, things like handheld ultrasounds and other diagnostic equipment, and they're putting it across over 11,000 islands in Indonesia. With that, becomes ECHO. We're written into the World Bank loan as their capacity building arm, where we're training in a hybrid fashion, because it's important to train on the equipment itself, but then we're supporting them because they get back out in the field and they need that continued support. That in-person training is really more for the, how to use the equipment than it is the kind of cases or the diagnostics and all of that. So we are supporting the ministry from the national hospitals all the way down to what they call the puskesmas, or the community health centers, across 11,000 islands, inhabited islands. And so that's an example of a very complex, group of stakeholders: public sector, ECHO, subject matter experts, academic centers, the World Bank, but when you can get people to work together, all with a common goal, everyone working, kind of rowing the boat in the same direction in a sense, then the impact can be so great. So even though I think the biggest challenge is just the multitude of stakeholders that have to come on board, at the same time, you will not see the impact unless you take that extra time and find a way to maneuver through the complexity.
And so the most important thing would be to align in terms of priorities and values, or like the mission, basically, like align what you do to
The
grow.
alignment is super important. And I do that in partnerships all the time. I mean, I won't even go after somebody where we're not aligned.
Right.
There's a waste of time.
But you don't share values even, right?
We are, values are super important. I just spoke at a conference in Hong Kong on corporate partnerships, and I talked to a lot about values. We're values driven. We actually, teamwork, for example, is a value. Joy of work is a value. Excellence and accountability are values. Service to the underserved is our, incredibly important value. We hire based on those values. That's so that we are aligned and everyone is working with that same mindset.
Right. And that applies to, you work with like big organizations, but if we will be talking about like smaller organizations, it's the same. Always looking for like the different views of different stakeholders, but how can they all get aligned and share values?
Yes. And I think when you have someone that they're not quite there. One thing I learned, I would say really when I was at Ashoka was I think it's really important to meet people where they're at and support them, not, tell them where they need to be. They have to experience it for themselves, but really provide them opportunities in a sense to experience empathy. And so that, if you can provide those opportunities for them, you're supporting their path of change making. And I think that's some of the greatest satisfaction I've gotten is, you don't have to take credit for it. You're just providing the opportunity for someone to move along in their own change making path.
Yeah, absolutely. I have a question here from Ikhlas Ben Abdallah. What distinguishes social entrepreneurship initiatives that create lasting systemic change from those that only deliver short-term impact? We're going to be talking more about systems change in the next few modules, but if you can start bringing us a little bit of what's the difference?
So even in fundraising, there is the old world of that transactional, aspect of, you go to a funder, they give you X dollars, and maybe with that, I use the example because I'm at a university, the difference between what I do and what a fundraiser at the university does. At the university, they need money for a new chemistry lab. Super important, don't get me wrong. New chemistry lab, 100 new microscopes, but that's transactional. What we do at ECHO is change systems. We strengthen health systems. What is that? That's a lot more complex. That has a lot of different answers, and it's nuanced depending on what community, what country, what geography, what disease area, any number of things that you're working in. And so I think that systems change is what ECHO does. It has to be the direction that we all take, because those transactional doesn't change people's lives. It puts a Band-Aid on it. And what we're really trying to do is change the system so that the problem doesn't exist anymore. There'll probably be a new one, but at least it allows us to exit that problem and work on the next challenge. There's never going to be a lack, as technology continues to evolve, there'll always be new challenges that come up. But if we can at least solve some of the ones that we have, and in healthcare, people should not be dying of diseases we know how to treat and cure just because they don't have access.
Yes, absolutely. So mainly the main difference between just buying the microscopes versus actually building the capacity and just changing the whole system. It's like the vision also of like what you want to accomplish, right?
Yes, I spent a lot of years at Ashoka, as you know, and I would hear, and I love this, but I've heard Bill Drayton say this, the founder of Ashoka, many times. He uses the analogy when he's speaking to a group of people. He'll say, "You've all heard the ancient Chinese proverb, if you teach a man to fish, he can eat for a day. If you give a man a fish, he can eat for a day. If you teach a man to fish, he can eat for a lifetime. But here at Ashoka, we're not satisfied teaching a man to fish. We want to change the whole fishing industry." And I love that analogy because it really does speak to what it is we're trying to do. And, because it's not enough to even, you've done it for one person, but you're trying to change a system so it's different from, here on out.
Right. Right. Thank you for that example. I think it's also very clear. Wonderful. More questions. We have a very active audience, I have to say. We have around 500 participants that are coming from all over the world, from
Wow.
the countries. So usually we have over 50 countries participating. And a question here from Rose Aka James. How did you navigate as a woman being a social entrepreneur and then a social entrepreneur and then working with both?
I've reflected on this. I went to a women's college, the very first one in the United States, Mount Holyoke. And I also was the first generation, which I don't really even think I recognized until I got out of college, the first generation of women that kind of more generally went to college. My job at National Geographic, I was the only woman hired.
Mm.
We were about 50-50 women, men, but I was the only woman not from a secretarial school. So this is 1981, early 80s. And even though I went to college and my job was the only position where they specifically sought a college educated woman, it was an all boys club, so National Geographic magazine. And it was Madison Avenue too, old. If you've seen Mad Men, then that
Right.
was my life.
The movie.
So I was asked to get coffee. I had just come out of a women's college. I was mad at Mount Holyoke for a while. It's like, you you made me a leader. You made me, you told me that I could do this. And then I started to realize, wait a minute, they prepared me for the fight. They prepared me to change things. And so I found that uh, I was not about to get coffee, just so you know, from my boss. But what also didn't want to, I had to figure out an innovative way to not get him coffee. I used self-deprecation and humor.
Mm.
And, you know, I sometimes I did get coffee once for him and said, "Oh, tomorrow you can get me one," or something like that.
Right, right.
And I found that that went a long ways, not being combative so much as
Mm.
getting people to see, and in some ways even showing them, allowing them to experience empathy for me and in that situation. And so I think it didn't happen overnight.
Mm.
And eventually I left. Part of it was that, and started my own business. So I think that there's where there's a will, there's a way. You'll figure it out. But yeah, as a woman, it was definitely hard, but at the same time, really rewarding. And it's really great to see, as I've continued along in my path, I've had the opportunity to mentor a lot of women. And it's been one of the most rewarding parts of what I do.
Amazing, Cynthia. Thank you so much for sharing your personal experience in that sense as well. And like time is flying by, as always does. And I would love to just ask you a couple more questions, personal, about what keeps you motivated to do the work that you're doing.
A mission.
Mm.
there's just no question about it. I had the opportunity to talk to our founder. He recently retired yesterday, and one of the things he said is, Cynthia, I knew right away when I hired you that you're just different than a lot of the people I've worked with over the years. That passion for the mission, I can't. I personally, I did it for about 6 months. That's how long I lasted. I went from Ashoka to a consultancy in
Got it.
Boston. And then even though it was focused on corporate social responsibility, it was still like for profit and driven by that and didn't have the same values. And so when the opportunity came up with Dr. Aurora, I jumped at it, and it has just been, I tell my own kids this, you have to love what you do because you work a lot of hours doing it.
Yeah.
So you really want to find joy in what it is that you're doing, and you want there to be that satisfaction that you're helping to make the world a better place in the smallest way. None of us are, we're just, one human being on the planet. So with humility, just working every day to make somebody else's life better, it pays dividends back to you over and over again.
Absolutely. Absolutely. The sense of meaning and purpose of what you're doing that is aligned with your own dreams, value. Yes, absolutely. Absolutely. And just like one parting advice, we have many novice entrepreneurs that are participating in the course right now. We also have experienced ones. What would you say to them?
I would say find joy, don't take no for an answer, and go out there and change the world.
Just do it.
Just do it, like Nike says.
Absolutely. Well, Cynthia, it's been a real pleasure, as always, to speak with you and to learn more about the work that you're doing at Project Echo, the incredible job that Project Echo is doing all over the world, which is quite impressive. And your personal experience as an entrepreneur yourself, entrepreneur, motherhood, figure skating, all of it. We're really looking forward to hopefully seeing you again next year. And for all the participants, thank you everyone for joining us today. It's been a real pleasure to be here with you. Next week, we're going to be seeing you for a community session, which is going to be different than a live webinar, where you're going to be able to interact with other participants, get to know them better, get to know the work that they're doing. We will also get to know you better so we can see a face and not just your name. And please don't forget to also, if you're watching us live right now, to click yes to the survey that you're watching live so that you can get your extra points. And also, please don't forget to complete your profiles. So if we don't get to see you face to face, we can still refer to you and see your work, where you're coming from, their industry, and we can get to know you better. And also that way we can connect you with your peers and we can promote some collaborations in between each other. Okay, thank you so much, everyone. It's wonderful to have you, and we'll see you next week. Thank you. Bye-bye.
Thank you for having me. Bye-bye.